Is my acne resistant to Accutane? That's the question that we're going to discuss today. Hello, I'm Dr. Arthur Kolsky, founder and medical director of the Advanced Acne Institute, and we are a dermatology practice that specializes only in the treatment of acne. So that's all we do, and we like to share our perspectives with acne sufferers who are trying to navigate the path toward clear skin. But the information that we provide is only for educational value. It is not meant to be medical advice. Is my acne resistant to Accutane? So that's a question that comes up from time to time. Thankfully, it's not a very common question because most patients do respond to Accutane quite well. So it's a medicine that has a very high chance of working well for almost everyone who takes it. But there is a segment of the population of acne sufferers that just doesn't respond. That segment doesn't respond to Accutane, or is not able to complete the treatment for various reasons. There are some cases then that we have to either not use Accutane, either because there's a medical circumstance that prevents us from using it, or because there is some other issue such as somebody planning a pregnancy, or because somebody is having another treatment such as laser hair removal. These are all times when we cannot use Accutane, and there are many other circumstances that might prevent us from using Accutane. But for the majority of cases, we are able to use Accutane, and the treatment typically goes quite well. Now, there are cases when we are achieving a good response, and midway through the treatment or toward the end of the treatment, things start to reoccur. Even before we stop the treatment, acne has begun to reoccur, to relapse. And this can be very frustrating. And this can be very difficult to manage because some patients, for reasons that we don't always understand, do have issues with Accutane treatment where they cannot complete the treatment with completely clear skin. And sometimes this is very complex and it takes a lot of teasing apart to try to figure out what exactly is the reason for that. Sometimes we have to do some hormone evaluations to see if there's a hormone cause for this. And other times there may be other reasons that we try to explore. Is the patient taking some other supplement or some other treatment, or are they under a lot of stress? And is the stress causing a relapse to occur? So there are a lot of things to consider when you're trying to decide why is somebody not responding to Accutane, or why is somebody having acne again when they initially began to get better. So it's not always a straightforward answer, and sometimes we just can't figure out the reason, and sometimes we end up without having a final resolution of acne with Accutane, and then we might need to use other options. And some patients develop a different circumstance where they flare up very badly when they are exposed to Accutane, and this can happen right from the get-go, right from the beginning of treatment. They can exhibit a very severe flare of their acne. And in these cases, sometimes we're able to manipulate the regimen and maneuver around and ultimately achieve a good, safe treatment. However, sometimes we can't. Sometimes every time we reintroduce Accutane, a tremendous flare-up occurs, even at a very low dose. So in these circumstances, sometimes it's just not possible for us to go forward with Accutane as a good treatment. But the good news is that typically, most patients do very well with Accutane. They tolerate the treatment very well, and they have a very good result. So there are those cases where we just can't use it, and we have to explore other options. But for the most part, Accutane is a very good option for the majority of acne patients.